Welcome back to the Splash Life. This is Dayan Chaaban alongside Tyler Keefe. So recently there has been a discovery. Healthcare officials in Oakland County discovered that there are pigs at the Oakland County Fair that has swine flu, that are infected with the swine flu. And 1 week later, a citizen in Lapeer County contracted that disease. Now we have Dr. Internal medicine specialist and Dr. Jamie Taweel here with us to explain all about swine flu and what to expect. Dr. Jamie, thank you for joining us today.
Thank you for having me. How is everybody today?
We're doing well. Thank you for asking. I hope you're having a beautiful Monday yourself. So, Dr.
So,
Jamie, sorry.
so far, so good.
Thank you. I hope it gets better as we go through the week. So, Dr. Jamie, as you said earlier, people are really talking about it in social media. They're really getting scared. I think it's also PTSD from COVID. So, can you please explain to us what is swine flu exactly?
So swine flu is a variant of the influenza virus, influenza A, that, swine flu is particularly a virus, an influenza virus that is common in pigs, otherwise, swine. So what happens is that back in 2009, there was a antigenic shift where the virus mutated and became available to infect humans. And since then, it has been circulating between pigs and humans. So it's essentially a variant of the flu virus that is now a little bit more accessible to humans through pigs, and essentially has caused this virus that we're now dealing with.
Okay, and how does this exact? Because we've heard that the symptoms are kind of similar, and we'll talk about the similars just a little bit later. But we've heard that the symptoms are kind of similar to other types of flu. So how does it differ from other types of seasonal flus?
It tends to differ just in how it's transmitted, but ultimately, when you get this virus, what's going to happen is you're going to have symptoms pretty much similar to the flu. You're going to have fevers, you're going to have muscle aches, you're going to have sometimes some GI upset, sometimes difficulty with breathing, coughing, achiness, sore throat, all of those typical flu viral symptoms that you get. The difference is with swine flu is, again, it is gotten from the influenza that has been circulating in the swine community, and then now it is infecting humans. It is something that we were a little bit less prepared for at the time. So, the traditional vaccines aren't going to be effective against it because it is a variant of the flu, and as well as certain types of diagnostics. So a lot of times, most diagnostics that will diagnose influenza A can pick this up, but not every time. It becomes a little bit more difficult to kind of monitor when you start to realize that this is shifting from animals to humans.
So, Dr. Jamie, how can this be? I understand that with the case from Lapeer County, it was in direct contact with the pigs at the Oakland County Fair. Are there any
Mhm.
other ways to transmit disease? How can people contract it?
Well, primarily, again, called swine flu for a reason. So what happens is that this is pigs are a great majority of pigs tend to get the flu virus that is contained within pigs. But every now and again, there can be a cellular shift of those particular types of viruses. And then what happens is once the genic shift happens and it becomes accessible to humans, now we're dealing with a problem that we're getting different routes in which humans can get infected by this. So what will happen is you have a pig that's infected with swine flu. This particular variant is now available for humans to contract. Humans will get it from exposure to pigs, either through fairs or through any other means, petting zoos, things to that effect. Fairs tend to be a little bit more specifically if they're traveling. And now once the human gets it, human can spread it from human to human. And that's essentially how these things tend to get a little bit blown up. Other things that can happen is, for example, the bird flu virus, was not able to be given to humans, but was able to be given to pigs. And once pigs were able to get contracted the avian flu as well as swine flu, those two viruses tended to cause a little bit more of cellular shifting, and that's how humans ended up getting the avian flu. So this begins to be a little bit dicey in terms of what types of variants of particular flus you are receiving, and it starts to create a little bit of confusion. However, the symptoms ultimately do remain the same, and people that are a little bit high risk will tend to have more severe symptoms. High risk people, of course, people with comorbid medical conditions, people with pulmonary conditions, people that have diabetes, overweight, asthma, etc., heart disease. These things are concerning. So we always want to make sure that we're trying to stay away and that we're doing the best that we can.
Perfect. And Dr. Jamie, you said that people who are at high risk or more susceptible to this swine flu are more likely to experience severe symptoms. Now, are there any long-term complications with the swine flu, specifically for these people or for any other people who contract it?
So ultimately, this is a variant of influenza A. So a lot of times we will see a lot of the long-term complications. Those are people that have comorbid conditions that have experienced things. For example, if you were to get the influenza and have lung damage, for example, that damage can be a little bit more of a long-term complication. Most cases of swine flu tend to be rather self-limiting, and can be treated with, you know, antivirals to help mitigate severe cases of this. However, there are people in high-risk groups, people that have, essentially weakened immune systems, people that have other medical comorbid conditions that can cause concerns, and medical problems that will follow them long term. But for the majority population, long-term effects of the virus in and of itself have not been studied in detail. However, it appears to be that most people that get this tend to do pretty well once they're over this. It's just a matter of trying to, reduce your risk of not only contracting it, but also reduce your risk of being considered a high-risk individual.
Dr. Jamie, just to wrap this up, how can people protect themselves and how important is it that people go and see their internal medicine professional or any healthcare provider for these specific symptoms?
As a healthcare provider, I'm always going to suggest you see one. But when you're trying to avoid getting the swine flu, viral precautions as much as anything else. Now, remember, swine flu comes from pigs, so try to avoid those things that will have pigs present. County fairs, things to that effect, petting zoos, any place that's not going to have routine testing to make sure that this isn't going to be an issue. Making sure that if you are exposed to them, that you're going to, use precautions. If you're going to be in a situation where you're going to be around pigs, sometimes wearing a very tight-fitting mask can help reduce the risk. There's if you find yourself having fevers, chills with an exposure to pigs or in public places, you definitely want to isolate yourself for at least 1 to 3 days after you have received symptoms, for 24 to 48 hours until you have discovered whether or not this is something that is communicable. It's always a good idea to contact your physician, and it's always a good idea to seek medical attention if you're having severe symptoms. And what I mean by severe is anything that's going to cause problems with difficulty breathing, difficulty with, chest pressure, chest pain, things, significantly high fevers that won't go down. That would require at least contacting your primary care physician or urgent care or emergency room just to make sure that there's nothing severe that's going on, and to get tested. Because a lot of times how we start to find these pockets of infection is obviously positive tests. We start to work our way back to where this may have started, start to contact the people that maybe have contracted this and have not shown symptoms yet, start to build a little bit of a net where we can figure out where this is going and how we can best get ahead of it.
Dr. Jamie, thank you so much. These are very helpful tips. And again, I also urge people to go to your healthcare providers. Dr. Jamie Taweel, thank you so much for joining us today, and we hope you have a very good week ahead.
Thank you so much for having me. I appreciate it as always. And if there's any other questions that you have, I'm always available to be contacted.